The worst STD anyone could ever have is an unhealthy soul tie. Ooh, child. Woo. Hey there, Bingo babes. Welcome back to my channel, BingoitsKimbo. I'm Kim, also known as the Good to All Doctor to Some, and this is episode 4 of the Vagina Demystified series. A series which focuses on the normal and not so normal conditions of the vagina. Last week we discussed bacterial vaginosis, aka BV, and yeast infections, the two most common causes of vaginal discharges that are not sexually transmitted. This week we'll be diving into vaginal discharges caused by sexually transmitted infections. Now, I know this topic is extremely sensitive, but very important, as these infections can not only cause discomfort, but in some cases can lead to chronic pain and infertility in both women and men. So we're going to talk about it. Before diving into the different types of infections and their specific discharge, let's first define 3 words that may come up while we have this discussion. First word, intermenstrual bleeding. This simply means bleeding or spotting in between your menstrual cycle. Second word, vaginitis. Now, itis, not the colloquial term which means fatigue after a healthy meal, but the suffix means inflammation. Therefore, anything before itis typically means that there's inflammation there. So, vaginitis means inflammation in the vagina. And 3, cervicitis, which is the inflammation of the cervix. Now, these definitions are not diagnoses, but rather a shared symptom of some of the diagnoses that can cause abnormal vaginal discharges. And it is very important to get to the bottom of the cause of vaginal discharge to ensure appropriate management. Okay, now let's dive into the STDs. In this video, we'll be dividing the STDs into bacterial STDs and protozoal STDs, followed by prevention tips and briefly touch on the treatment for these infections. So first up for bacterial STDs is gonorrhea, also known as the clap or the drip. Now, this is such a very descriptive but accurate nickname for it because of its copious discharge, but we're going to talk about that a bit later. This infection is caused by a bacteria known as Neisseria gonorrhea, and persons who have this infection can be either symptomatic or asymptomatic, meaning they don't show any symptoms. In fact, up to 50% of persons who are infected with this infection don't show any symptoms. It is spread by penile and vaginal secretions that are usually exchanged during sexual relations and or the sharing of sexual toys or items. Notably, gonorrhea can be transmitted to the eyes through infected secretions causing a conjunctivitis, and it can also be transmitted to the throat, and lastly through childbirth. Gonorrhea is not transmitted through casual contact such as eating, drinking, coughing, sneezing, hugging, or sitting on the same toilet seat. Nope. I don't care what you read. You cannot get gonorrhea from sitting on a toilet. Now that we got the other way, we can discuss the symptoms of gonorrhea. As mentioned before, up to 50% of persons who are infected with gonorrhea actually show no symptoms. However, if you do show symptoms, usually it appears about 1 week after contracting the infection. Include 1, a copious yellow to green or even bloody discharge with a very strong, unpleasant odor. Did I mention it's copious? I think I said copious, okay, because copious is very important because it's not like a little bit of discharge, it's a lot. Like a lot, like a whole heap. of discharge. 2. Pain or a burning sensation with urination. 3. Pain during sex. And 4. Intermenstrual bleeding. This is because of the irritation inside of the vagina, resulting in the very delicate flesh inside ripping and tearing and resulting in bleeding. For men, any of these 3 symptoms are very notable for gonorrhea. 1. A copious, like a whole leak of yellowish, whitish, greenish discharge coming from the penis. 2. A burning sensation when urinating. And 3. Inflammation or irritation or swelling of the testicles. And remember, up to 50% of persons do not show these symptoms, but even if you don't show the symptoms, you can still transmit the infection. Next up is chlamydia, aka the clam. This bacterial infection is spread the same way that gonorrhea is, through sexual fluids such as penile or vaginal fluid. This infection, even more than gonorrhea, can be asymptomatic. Up to 70 to 80% of persons infected with this infection show no symptoms. But when symptoms do show, they usually present a bit later, like up to even a month later. And the symptoms include 1. Pain. Pain during urination and or sex, and or lower abdominal pain that is very dull and very uncomfortable. 2. Abnormal vaginal discharge that is copious and can be from yellowish to greenish with a very strong scent that is unpleasant. In fact, the discharge for gonorrhea and chlamydia are so hard to differentiate that usually both of them are tested for and treated if a patient presents with a copious discharge, in keeping with either one of the 2 of these diagnoses. Intermenstrual bleeding. As for men who are infected with this infection, the discharge is very notable. It is described as a milky or a pus-like discharge associated with testicular swelling and or pain in the penile shaft. Alright, now it's time for the protozoal infections, namely Trichomoniasis, aka Trich. You may not have heard of this particular infection, however, it is the 3rd most common cause of vaginitis. First being bacterial vaginosis, second being the yeast infection. The difference between BV and the yeast infection and Trichomoniasis is that Trichomoniasis is solely a STI. That is very hard to pronounce. Just call it Trich, nobody try to bite it off. This infection is caused by a very tiny parasite, yes I said parasite, that is very easily transmitted through sexual fluids. Similarly to chlamydia, about 70% of persons infected with this infection are asymptomatic. However, when there are symptoms, the symptoms include an abundant yellow, green, or even off-white, foamy discharge with an unpleasant smell. Now, I know you've heard a lot about yellow or green, so how do you tell the difference? With this particular one, the discharge, unlike chlamydia and gonorrhea, tends to be a lot more foamy in character. 2. Intermenstrual bleeding. 3. Itching and irritation around the vagina. 4. Swelling around the genitals because of the itching and irritation on the outside of the vagina. 5. Pain during sex. And 6. Urinary symptoms such as frequency, which means having to go to the bathroom more often, and burning and discomfort with urination. Because of this particular symptom, sometimes trichomoniasis is confused with a urinary tract infection. By the way, I'm gonna cover UTIs, like it's a must. Don't worry, it's coming, but I digress. Speaking of misdiagnosis, trichomoniasis can also be mistaken for yeast infection because of the itchiness and irritation and swelling outside of the vaginal area. However, as discussed in last week's video, so if you haven't watched the video, you know what to go and watch after you finish this one. A yeast infection has a typical discharge that is very thick and clumpy with a minimal odor, in keeping with a cheese-like or bready scent. Unlike Trich, as we just discussed, which has a very foamy, yellowish, greenish, or even whitish discharge that has a very strong odor. So it goes without saying that once you're engaging sexually, you are at risk of contracting a sexually transmitted infection. However, there are a few things that you can do to minimize this risk. Number one, using a condom every time. Even if your partner passes the whiff test, still use a condom. The reason being is because up to 70 to 80% of persons with an STI can have no symptoms. Not even a little smelly smell, like nothing. The only way to know is to get tested, which is point number 2. Once you're sexually active, get tested every 6 to 12 months. Yep, I said it, 6 to 12 months, or every time you change your partner. Which brings us to the third point. Minimize the amount of partners that you have. I'm not attacking or judging, I'm just saying the more you touch a hot stove is the more likely you are to get burnt by that hot stove. Not to mention soul ties. It's real. It's real. Like, it's real. 4, not having casual or non-committed sex. 5, having sex while you have an abnormal vaginal discharge. I mean, for many reasons, I can name a few, like, that's unsanitary. But also, it increases your risk of getting an infection. Now, just because you have sex with someone who has an infection doesn't always mean you will get the infection. However, if you already have an infection such as a yeast infection or bacterial vaginosis, and then you come across a partner who has gonorrhea, then your chances of getting gonorrhea is like 10 times more likely, even though it's already very likely in the first place. So don't have sex when you already have an irritation or infection in the vagina. Lastly, avoid having sex with a partner that has an abnormal discharge. Now, as mentioned in the first video, discharge is a normal part of the vagina. So there is a such thing as normal discharge, and if you're unfamiliar with what it is, you can check out the first video. However, there's quite a few things that are abnormal, as discussed in the third part of this series, which is also right here or here. If a man has a penile discharge, something is wrong. Nope, not normal. Not at all. The treatment for the discussed infections require a doctor's visit, a thing that many persons are extremely terrified of, intimidated by, or even embarrassed about. But remembering that you are not alone, and remembering that your doctor's sole purpose is to help you, is a great start to overcoming the anxiety of the doctor's visit. In fact, I think I should do a video on how to prepare for the gynecologist. Let me know in the comments below if you think that would be a great video idea. The visit will include a chat about your symptoms and your sexual history and overall medical history, a vaginal examination that may or may not include a swab of the vagina, and a blood test and or urine test to test for STDs. If you do have a sexually transmitted infection, you receive antibiotics and or vaginal inserts. Here are some hard and fast rules for treatment of STIs if you ever find yourself being treated for one. 1. Keep calm. 2. Take all your medication as your doctor prescribes it. Even if your symptoms go away and you only have 2 digga pills left, take the pill. Finish the entire dose, because the infection is still in your blood system and can return if you do not treat it properly, and chances are it may return 2 times as worse as it was before. 3. Your partner should also get treated for the infection. Yep, this requires open and honest communication, so if you haven't established it already, now is definitely the time. Also, if you get treated and your partner doesn't get treated after your treatment is completed, your partner will just reinfect you. So to remove the problem from the relation, both partners have to be treated. 4. Do not share your medication with anyone. So if you get your dosage, do not split it in half and give it to your partner. Always request treatment for your partner if it wasn't already given to you. Next, abstain from sex up to 1 week after your treatment has been completed. If you have 1 day of treatment, wait a week. If you have 7 days of treatment, wait a week. Do not, I repeat, do not engage in sexual activity while on your treatment. Next, if you still have symptoms after all your medication is completed, contact your doctor to ensure that you're properly treated. Next, get tested again in 3 months to ensure that your infection is gone. After this, get tested every 6 months to a year once you are sexually active. Lastly, even if you finish all your medication and you're in the clear for gonorrhea, trichomoniasis, or chlamydia, it is possible for you to be reinfected. So use a condom every time, minimize your sexual partners, and all the other prevention tips that we discussed earlier in this video. The last point of this video, and one of the most important points of this video, is if you have any symptoms of a sexually transmitted infection, or you've been exposed to someone who's had a sexually transmitted infection, or you haven't been tested within the last year and you're sexually active, I want to encourage you to go and get tested. There's no shame in being tested. It's very important that if it is a case where you have any of the sexually transmitted infections discussed, that it is treated, because the consequence of not treating it includes 1, PID, pelvic inflammatory disease. This is an infection of the uterus, where the infection spreads from the vagina into the uterus, causing scarring and chronic pain, in addition to infertility in some women. It is something that can be completely avoided with proper workup. So remember, you are a huge priority for you. Ensure you take care of you. 2, men. I know men feel like they're not included in this, but a prolonged infection in men can also lead to chronic pain in the penis, as well as infertility, as things such as gonorrhea and chlamydia can affect the sperm as well as the urethra, the passage in which sperm passes through. So I want to encourage you to get tested every 6 months to a year once you're sexually active. And that is a wrap for this video. I really hope you guys found it helpful. Don't forget to share it with a friend, co-worker, your partner, your mother, your father, your auntie, sister, your brother, whoever. Send the video. Trust me, this knowledge is very important. I appreciate you guys watching my videos, liking them, sharing them, commenting below, and most importantly, subscribing if you haven't already. I'll see you guys next week with another video. Bye.